Welcome to the Voices of Healing podcast, where we give you holistic solutions to your everyday health problems. My name is Tina Clark. I'm your host. I'm a shamanic Reiki master teacher based out of Charleston, South Carolina. And today's guest is Dr. Kevin Smith. He's a chiropractor and the head of the Chronic Condition Center in Pittsburgh, Pennsylvania. So there's a lot of different topics we could talk about today, but before we jump in, Dr. Kevin, can you tell us more about your background and what you do?
Okay, Tina. Well, first of all, thank you for having me. It's a pleasure to be on your show. I am in Pittsburgh, Pennsylvania. I've been in practice for about 25 years, and my base degree is I'm a doctor of chiropractic. But I'm also a board certified in clinical nutrition and in functional medicine. And over the time, I've kind of evolved into functional medicine as the primary thing that I help people with. Functional medicine is a patient-centered, personalized approach to healthcare. In the United States, there are two broad classifications of healthcare. There is allopathic healthcare, which is what medical doctors practice, and there is functional medicine healthcare. Allopathic healthcare is all about chasing down symptoms, usually with a drug or a chemical. Whereas functional medicine is all about finding out the reason why do you have that problem. Like, for example, why do you have high blood pressure? Why do you have thyroid problems? Why do you have kidney problems, etc.? Whereas the medical doctor doesn't really ask that question. What the medical doctor's approach is, if you have a certain array of symptoms, you're put into a diagnostic box. And if you are in that diagnostic box, then the protocol is you give them this, and this, these different medications. We live in a drug society. And I believe that there's a time and place for all healing. There's a time and a place for surgery. There's a time and a place for medications. There's a time and a place for physical therapy, for chiropractic, for all kinds of different tools. But I believe that as a people, we're over medicated. And so what happens is that we let ourselves go, we don't take care of ourselves properly, and then we develop a problem and we rely on pharmaceuticals to clean up the mess afterwards. And that's the society that we live in. And what I do that's different is medical doctors will order labs. I order labs. They do a workup. I do a workup, and that's where there's a lot of similarities. Where the differences are is the approach that we do to try to help the situation. My approach is completely drug-free and non-surgical. So people that come to see me, those people have usually already been down the pathway of medicine. They've already tried surgery. They've already tried medications, and they're dissatisfied. It's just not working. So they come to see me as a different way of looking at things, and usually can resolve these types of problems.
Well, you're like the perfect guest for this show.
Well, I hope so.
Yeah, the drug-free, non-surgical solutions. So functional medicine gets into the why someone has a health issue. Now, how do you go about figuring out the why?
Okay, so what I do is the first thing I want to do is to gather some basic medical background information. So I have the person start by filling out some forms, like their complaints, how long they've had these problems, what they've already tried to remedy these problems, what the outcome was. So I'm not stepping on any toes. After that, then I start by, or the second thing I do is I have them fill out some metabolic and some neurological questionnaires. And these are not a diagnostic. These are more of like a place to start looking. So the metabolic questionnaire will cover the person's their gut, their colon, their small intestine, their stomach, liver and gallbladder function, their ability to utilize glucose and sugars, their adrenal function, their thyroid function, electrolytes and pH, chemical sensitivities, sex hormones, things like that. And then the neurological questionnaire evaluates their brain function. It evaluates their general brain function, their stress response, the neurotransmitters such as serotonin, dopamine, GABA, and acetylcholine. So I can take a closer look at that and find out where the stress points are, where they may be having some issues. From there, the next thing to do is to start by gathering some information via foundational lab testing. So I'll send them out for some urine testing and some blood testing. And I usually send them to LabCorp. And then I measure 63 different biomarkers. It's a lot more than you get when you go to see the primary care doctor. And from there, that gives me an understanding about how severe the case is and how far out of bounds is their physiology. And then from there, there could be further testing down the road. The purpose of the testing is to identify specific triggers that could be throwing off their physiology.
So I know that you treat a lot of your clients with thyroid issues. Can you talk more about that?
Absolutely. So the thyroid is the small butterfly-shaped endocrine gland that sits the front of your neck right above the little notch. And the purpose of the thyroid gland is to produce thyroid hormone. It produces T4 and T3 and also calcitonin, but that's for another talk. T4 and T3 are thyroid hormone. And the purpose of thyroid hormone is it regulates how much energy that your body uses while it's at rest. So the analogy that I can use for that is like it's an accelerator pedal in the car. If you step on the accelerator, the car's going to speed up. If you take your foot off the gas, the car's going to slow down or it's going to stop. Every single receptor site, or every single cell in your entire body, all 70 trillion cells, has a receptor site on the cell wall for thyroid hormone. What that means is that every single cell is going to be influenced and affected by your thyroid. Everyone, every single cell. So if the cells are, say, in the brain, if they're the neurons, that will affect your brain function. So if you don't make enough thyroid hormone, or you have hypothyroidism for whatever reason, that person could have brain fog. They could have memory problems. They could have cognition issues. They could have mood problems. They could have problems like brain fog, irritability, depression, anxiety, forgetfulness, all these things. If it affects the gut, then the person could have abnormal GI function, such as constipation or diarrhea or both, alternating between the two. It could affect the absorbability of your food. It can affect, it can cause bloating, gas, abdominal distension, all kinds of problems. And throughout the entire body, it can affect all kinds of internal organs or your musculoskeletal system. And I would consider the thyroid to be a master regulator of the body.
So what kind of problems I just heard something and I'm not sure it's true, but because this is my field, of holistic healing, is there might be a connection between the use of birth control pills and thyroid function later in life. Have you heard about this?
There is a relationship that exists. I think that one of the what I call triggers, one of the peripheral things that can cause dysfunction within the thyroid gland are things like anemia, blood sugar regulation. That can include insulin resistance or type 2 diabetes. It could include cortisol issues, which is your stress hormones. It could include your sex hormones. That would include progesterone, testosterone, estrogen, things like that. Remember, boys and girls make both, and they have to be in the right amount and the right balance. And it could include chronic inflammation, oxidative stress, GI dysfunction, food allergies or food sensitivities, chemical sensitivities, and stealth infections, such as a low yield viral infection. Now, how this plays into your question is the sex hormones can be affected. So if you take conjugated estrogens, which is what birth control is, then that person could have either too much estrogen, or they become estrogen dominant, or they can have a problem with their balance between estrogen and progesterone. Estrogen helps the body, the female body, prepare for pregnancy, and progesterone is there to sustain the pregnancy. And so if you are overwhelming the body with birth control pills and the body can't tolerate it anymore, that can also cause dysfunction with your thyroid gland and cause problems elsewhere in the body.
Yeah, and what really happens, like say you've been to your hormones, you've been on birth control for a really long time,
Mm-hmm.
and then get off of it. And, I experienced this personally. I just felt like everything went haywire after that. I was
Mm-hmm.
okay on the birth control pill, but when I got off, that's when things got, challenging.
Right. So the body starts to withdraw from hormone replacement therapy, whether it's extra thyroid hormone or conjugated estrogens. And there's an adjustment period that has to go on when you get off of those medications. Sometimes they want to wean you off gradually over time so that you don't develop various weird symptoms that go on. A lot of women that are like, they're going after their childbearing years, they go through perimenopause and then menopause. And when the estrogen levels start to plummet, then what happens is that the parathyroid glands, which sit right behind the thyroid, start to leach calcium out of the bones. And that sets the stage for osteoporosis. So a lot of women, especially very petite women that have to go through the change of life, they are at high risk of a compression fracture or a problem where you develop an old lady's hump in the back of the neck. Not only is that very unsightly, it's also very painful. So these problems can manifest into musculoskeletal problems, especially if the gal is very petite and they don't weigh a lot. They're at high risk of developing bone problems in later life.
What does the size of the woman have to do with it?
Bone is a living tissue. It's not static. It actually, you have different bone cells called osteoblasts and osteoclasts. Osteoclasts remove bone and osteoblasts produce new bone. And so it's always remodeling itself according to areas of stress. So according to the scientific literature, when you have a gal that's very, very petite, she doesn't have a lot of gravitational stress imposed on the body. As a result of this, the bones aren't challenged a lot. Whereas women that are bigger or heavier or lift weights have more density to their bony structure. I'm also a chiropractor, so I know a thing or two about bone health.
Yeah,
So there's a relationship that exists between the thyroid function and sex hormones and bone function.
that is so interesting because I have a friend who just recently got diagnosed with osteoporosis, and she is petite.
Yes, it's
But
very
I
common.
also asked her if she exercised regularly, and she didn't.
Yeah. So women that when you exercise, there's different types of exercise. There's like cardiovascular training, there's weight resistance training, there's flexibility training. And so women that are involved in weight resistance training typically have the strongest bones and the strongest joints. So it's one of those use it or lose it kind of situations.
Hmm. That's why I always say keep moving, no matter what.
Exactly. Or you start to rust, figuratively.
If you don't move it, then you really lose it, you know?
Exactly.
So you also treat people with autoimmune. I feel like autoimmune is kind of a mystery for us all on what to do with that. And I have family members who have, I have a family member who has all four kinds of lupus.
Well, I'm sorry to hear that.
Yeah.
First, I want to define what autoimmune disease is, and then kind of unpack this a little bit. So, your body's defense mechanism is called the immune system. Those are the white blood cells that go throughout the circulation, and they look for things like bacteria or viruses or a parasite, and they remove them to try to keep you healthy and protect you. And that's the normal function of the immune system. However, when the immune system starts to mistakenly attack and destroy your own body, that's called autoimmune disease. Auto meaning self and immunity. So there's over 100 different autoimmune diseases that have been identified by researchers, and they're all basically named based on which body part is being affected. For example, if it affects the thyroid gland, that's called Hashimoto's disease. And if it affects the lung fields, that's called sarcoidosis. If it affects the brain, that's called multiple sclerosis. If it affects the joints, either in your hands or in your spine, that's called rheumatoid arthritis. If it affects the skin, that's called psoriasis or psoriatic arthritis. So there's a lot of different areas of involvement. Now, one of the things about autoimmune disease is that you cannot cure autoimmune problems. Once you have it for the rest of your life. It's hardwired into your genetic code. But while you can't cure it, you can put it into remission. So you can, it's like a dimmer switch that will regulate the light in the chandelier in your dining room. You can turn it all the way down so it's no longer causing an issue. And that is the best hope that you can have for autoimmunity. The medical community deals with this problem by giving you immunosuppressant drugs. And immunosuppressant drugs try to calm down the immune system somewhat so that it can no longer cause problems. They can only give you so many doses per year. So if you get, like, say, cortisone for like injections for knee pain or back pain, you can only get that once every 3 months. And because if you exceed that amount, you're at high risk for developing colds or flus or an opportunistic infection. You have to have a working immune system. It has to be there to protect you. But if it's too rambunctious, you got to calm that down. My approach to fixing this problem is by identifying the part that can cause the autoimmune in the first place. So what I found is that for many people or most people, it starts in the gut. And that's a problem called intestinal antigenic permeability syndrome or leaky gut syndrome. And what happens with that is that the gut lining starts to fail, and the food particles that go through the gut start to enter the bloodstream at an abnormal rate, abnormal level. And when the food particles enter your bloodstream, your body doesn't know what it is. It doesn't know what to make of it. So it thinks it's a bacteria, it thinks it's maybe a parasite. So it starts to attack that food particle. And when it attacks it, that's an autoimmune cascade. That's what starts the whole process. There's a relationship that happens between autoimmunity and chronic inflammation. So, for example, if a person has autoimmunity in their gut, then they can develop Crohn's disease or ulcerative colitis. and that can set off a whole cascade of symptoms with that. Now, getting back to the thyroid gland, I mentioned before that that autoimmunity that affects the thyroid gland is called Hashimoto's disease. 90% of everybody that has low thyroid disease has Hashimoto's. That's 9 out of 10 people that have never been diagnosed or have been misdiagnosed that have this problem. That's not part of your endocrine system at play. That's your immune system. So for most people that have low thyroid, my question is, who is managing your immune system? The answer is probably nobody.
Hmm. And what does lupus affect?
Lupus, or systemic lupus erythematosus, is a body-wide problem that can affect the entire body. It typically presents with a butterfly-shaped rash around the nose. It can affect the joints, and it can affect the facial features, all kinds of things. But it's more of like a body-wide problem rather than an organ-specific issue.
Yeah. So what do you do? What if a listener out there gets diagnosed with autoimmune?
Okay, so the first thing that I would do for autoimmune is I would verify where it's coming from and what parts of the body are being affected by it. Is it affecting the thyroid gland? Is it affecting the joints? Is it affecting the brain? One thing about autoimmune disease is it's kind of like a schoolyard bully. If he's picking on kids over here, he's probably picking on kids in other places too. So it's very, very common for people that have autoimmune disease to be affected in more than one location in their body. So it's very important to identify all those places so we can try to help that person. What I want to do is to remove any kind of offending agents that can trigger autoimmune attack. There's certain types of food agents, for example, like things that you can eat your whole entire life, or they can be identified by using a food allergy test that I administer. And there's also certain foods that can mimic the effect of autoimmunity on the body. They can like things like gluten, or certain foods that can mimic the effect of gluten can affect the immune system really, really profoundly. And the way around that is to run some lab tests. These are from a lab that I use called Cyrex, and there's different arrays. There's different lab tests. One of them is specific to neurological problems. One of them is specific to chemical sensitivities. One of them is specific to foods. So it all depends on where the problem is coming from. Remember, there's no one size fits all to this. It has to be very patient-centered and very personalized to that particular individual.
Yeah, it makes sense because we know that the gut is a huge part of our immune system. So if our gut's not functioning correctly, it's going to affect everything else.
Correct. 80% of your immune system is in the gut. So if you eat very poorly, if you eat a lot of fast foods or highly processed foods, after a while, it's going to manifest as having problems in your gut. And there goes your immune system.
Yeah. What about alcohol's effect on immune system?
In moderation, in small amounts, alcohol doesn't really seem to affect it very much. I don't drink, but people that will have a cocktail or a beer or something from time to time, they generally aren't affected as much as somebody that lives in the bar all the time.
Yeah. What if you already have autoimmune disease? Should you be avoiding alcohol?
I think that's a smart idea, is to avoid anything that you can that can possibly trigger a autoimmune cascade. And I'm a big fan of getting back to the basics, making sure that you have optimal nutrition, making sure that you're getting plenty of exercise, making sure that you're getting plenty of sleep, managing your stress, either through meditation or massages or whatever works for you, making sure that your posture and your nervous system is well regulated through chiropractic care. Making sure that you're taking good quality supplements, not the stuff they sell at Walmart or the dollar store, but really professional quality supplements that can absorb well and do you a world of good.
What are some of the better brands that you recommend for supplements?
So what I do is I recommend orthomolecular and Apex. Those are professional level supplements. They are not available to the general public. You can't buy them on Amazon. You generally have to get it through a licensed healthcare professional. The reason that they're very good is because they're formulated using the best raw materials that they go into the supplement. They are backed by research. They've researched this stuff. They've compared it to pharmaceuticals, and they've published the studies in medical journals. And they're independently tested outside of the company. Regulatory companies will go in there and they'll measure things, they'll check things, so they'll verify that what's in the label is what's in the bottle. You're not going to get that if you buy stuff at Walmart or if you buy things at Costco or Sam's Club. There's a reason that you can buy 8,000 fish oils for $20 at Sam's Club. You don't want to buy anything that is going to be sitting on a pallet and oxidizing for years and years and years. You want to get the freshest stuff you can with the best raw materials you can.
Makes sense. So can you tell us what the problem is with drugs?
So I think that, like I said, I think there's a time and a place for all healing. There, people in this country, they rely too much on medications, and we live in a drug culture. So a lot of people feel that there's a pill for every ill, and they want to just continue to pile it on. One of the problems is that if you, like, for example, if you take one drug, if the person takes one drug, there's a ton of information on it. There's a lot of research. There's maybe 13 years of clinical research that goes into introducing a single drug into the market, including drug trials, random controlled double-blind studies. The FDA has 3 levels of investigation that they do. But what would happen if you mix drug 1 with drug 2, whatever they may be? There's zero data. You have no idea what can happen as far as interactions or side effects. Typically, people that come into my office, they show me their drug list, and they are taking about 5 to 7 drugs. And who knows what the side effects could be from taking all those drugs. The most I've ever seen in my career, a guy came to see me a couple years ago, and he brought me his drug list. It was a page and a half, single space typed. And he walked in like a zombie from all the drugs he was taking. They were all prescribed by well-meaning medical doctors, but the medical doctors clearly don't talk to each other. They don't communicate, and they don't know, like, is he taking too much of this? Is he not taking enough of that? I had another example where a woman that was about 43 years old, she was complaining about constipation all the time. That was her number one complaint. She couldn't go to the bathroom. And I looked at her drug list, and I did an investigation of all these different drugs, including the side effects. Almost every single drug she was taking had a side effect of constipation. And I said, you need to talk to your doctors about this and see what their thoughts are. Maybe they can get you off of this. I don't take people off of drugs. That's not my license to do that. But I will educate them, and I will say, why don't you learn a little bit more about the drugs that you're taking, and maybe talk to a pharmacist and ask them their opinion, and then go back to the doctor. I think whatever doctor puts you on that drug has to be the doctor to take you off that drug. That's just common courtesy. And so my goal is to have people get better using the least amount of drugs possible.
I mean, usually when you go to a doctor, even if it's not one you usually go to, they ask you what medication you are on.
Right,
So they already know what medications you're taking.
right. Theoretically.
But so interesting about the
And by
data that
by the
there's
way,
still,
it's very common for people when they go to a doctor to forget that they were taking that drug. They think it's none of his business. They don't have to worry about that. It's not a problem with me taking this. And so a lot of times people don't tell the doctors the complete story.
I mean, some doctors are asking about supplements,
Right.
what supplements you're taking.
Well, my take is that I would like to know how much training that doctor's had and um, supplements, nutrition. I have 25 years of training in this. I've gone to countless seminars. I've written 2 books on the topic. I'm a public speaker. I'm the guy that people turn to if they have a certain question about a supplements and what is good and what is bad. There's 4 levels of supplements that people can get access to as consumers. Level 1 is the stuff that they sell at Walmart or the dollar store or those big box stores like Sam's Club or Costco. For the most part, it's just crap. It's formulated with the cheapest possible raw materials. It's not very well absorbed, and I would just say stay away from that. Level 2 is what you get to find at a pharmacy. Let's say things like Costco. No, I'm sorry, Costco, CVS, Walgreens, a supermarket pharmacy. Those type of things are generally better than the stuff that they sell at Walmart. They're more absorbable. They're made with better raw materials. They're gonna do a better job. Level 3 supplementation is what you're going to find at GNC or at Vitamin World or even certain things that you can find on Amazon. It's generally better quality than the pharmacies. And then level 4 are what I refer to as professional quality supplements. Those are formulated using the best raw materials. It's the most absorbable into the body. They're backed by research and they're independently tested. But the downside is that you cannot just, as a layperson, go in and pick that up. You have to get it from a licensed healthcare professional, whether it's a chiropractor, an MD, a doctor of physical therapy. A lot of those guys are very, very knowledgeable about this stuff.
Oh, good to know. I was kind of lumping in like low quality supplements, the first 3 levels, but I didn't realize GNC and Vitamin World had better quality supplements.
Yeah, they do. They're generally better than pharmacies because the stuff that they sell is made better. It's made with better raw materials and it's just more absorbable. See, if you take a supplement, it has to get into your bloodstream. It has to do a physiological response. If you're just going to let the supplement go when you go to the bathroom at the end of the day, it's not going to do you very much good. So you got to make sure that the supplement is going to do its job and it's going to get into your system and do what it claims to do.
Okay. What are the 2 books that you've written? Can you tell us the titles?
So the first book I wrote in 2010 on modern chiropractic, the way to a pain-free lifestyle. At that time, that was where my focus was in life. I wanted to help people that suffered with headaches, migraines, neck pain, back pain, knee pain, sports injuries, automobile accident injuries, repetitive stress injuries from, say, playing a musical instrument or working on a keyboard and a mouse all day. And then the newest book is not available yet. It's in the editing process right now, and it's on functional medicine. It's about the things that we're talking about today.
Mhm.
And the title is to be determined, probably going to be Metabolic Solutions, but it talks about all the different triggers that we talked about that can cause a disruption with a person's thyroid function.
You should call it thyroid triggers.
I'll consider that. Yeah.
Yeah, something, grabs people's attention.
There you go. I think I'd have to give you credit if I do.
Well, please do. I have lots of ideas. So if you need any more ideas, I'm here for it. So, Dr. Kevin, any last parting words? Anything listeners really need to know what's important about healing, holistic
Certainly. So,
healing?
so if you have a medical condition or you have some kind of a health problem, whatever it may be, whether it's autoimmunity or it's thyroid issues, if you have low energy, weight gain, even with diet and exercise, your hair is falling out in clumps, or you have weak or cracked fingernail beds, insomnia, either falling asleep or staying asleep, you have abnormal gut function, either with constipation or diarrhea, or you have brain fog and you walk into a room and then you can't remember why you walked in that room. Those are all signs of thyroid dysfunction. And if you are having those problems and you're not getting anywhere with going to the medical doctor, please reach out to me. Let's see what we can do to help you. You can reach out to me by visiting me at metabolic.Net. Don't go to .com. That will take you to another site. But go to metabolic.Net, or you can give me a call directly at area code 412-595-7332. And what I would start is by doing a discovery call. That's a very simple phone conversation. It's about 10 to 15 minutes long, and that's just for us to tell me what's going on, what's been bugging you, and what have you done so far? What have you tried? You're going to an endocrinologist or your family doctor or your supplements, and if you have any questions about what to do next, and we'll talk about that. And I'll give you my honest opinion about what I think is going on and what you can do to have a better quality life. So that number again is 412-595-7332. So,
And all that information will be in the show notes. And if we'd like to get copies of your book, is that available on your website or Amazon?
yes, eventually it will be on both. So for people that would like a free copy of my book, just ask. I'll be happy to send you a PDF, an ebook, and send it out to you. And if you have any questions, give me a call.
Great. Thank you, Dr. Kevin Smith, for being on the show and explaining all these things, because I feel like a lot of these terms are thrown out about and we don't really know what they mean or what causes them. So thank you for that.
You're very welcome, and thank you for having me, Tina.